Dear colleagues, today I'm going to briefly report you about the practice in Serbia regarding the education and training in geriatric medicine, preoperative risk assessment, and assessment on functional status and frailty. Regarding education and training in geriatric medicine, it's, according to my opinion, insufficient in Serbia. So we have geriatrics as a subject just at one university, just at one faculty of medicine, University of Novi Sad, and it lasts for one semester and it takes only 30 classes, 15 classes of lectures and 15 classes of exercise. At my faculty of medicine, University of Belgrade, we have some training, undergraduate training in geriatric medicine, but it's a part of clinical practice in general medicine, and we have just 2 classes of lectures and 10 classes of exercise. Regarding postgraduate education and training, geriatric is recognized as a subspecialty from 1995. It's 1 year, it requires 1 year training, and who can apply? Doctors after specialization in internal medicine, which takes 5 years to finish, or general medicine, which is 4 years. And training is at University Hospital in Belgrade, at Faculty of Medicine, University of Belgrade. Preoperative risk assessment is done by an anesthesiologist, and obligatory requirements before assessments are complete blood count, basic blood chemistry, screening of coagulation as prothrombin time, chest X-ray, and consultation of the internist or cardiologist. There are also some conditional requirements. Frequently, anesthesiologists ask for consultation of other specialties, excluding geriatricians, according to the comorbidities of the patient. Echocardiography is quite often asked. Spirometry, rare, which is a little bit strange, and consultation of the geriatrician is almost never asked. Why is this like that? Why the consultation of geriatrician is almost never asked? Is there some prejudice against geriatricians? Because my impression is that many of my colleagues in Serbia think that geriatricians are some doctors who are taking care of the elderly in some nursing homes or long-term cares. Maybe, I don't know. Maybe the lack of geriatrician in my country, we have just around 40 geriatricians, and it's a really small number for 8 million people living in Serbia, or it's something else. When they ask me to come as a consultant in preoperative risk assessment, they ask me to come as an internist or cardiologist. But just one, this is interesting, just once they asked me to come, or no, twice they asked me to come as a geriatrician, and there was a patient, one patient, woman and one man, and there were mother and a father of some very important persons, and at that occasion they asked me as a geriatrician. So there is not only the lack of geriatrician in my country, because in my hospital, for example, it's a big hospital, and we have 15 geriatricians. And to ask me just twice for, let's say, 15 years, I think it's not so often, or it's something else. It's for discussion later. Okay, regarding the assessment of functional status and frailty of patients over 80, ADLs, activities of daily living, are assessed with CATS index, and they are applied. It is applied in some institutions for home care and treatment. Instrumental activities are, or assessment. It's assessment with Lawton scale. This is applied rarely. Frailty is not assessed by classical criterion like Fritz or scales like clinical frailty scale at all. And comprehensive geriatric assessment is applied in some institutions for home care and treatment. I will show you which are the domains which should be assessed by comprehensive geriatric assessment in all home care patients over 75, because it is a part of national program for health care of the elderly. And it includes cognitive assessment, emotional status, motivation, self-perception of health, communication, muscle strength, mobility, balance, falls, incontinence, nutritional status, also ADLs and IADLs, marital status, needs for assistance, need for palliative care. At the end, there are diagnoses and suggested interventions. But it is really, time-consuming, and most of the doctors at the primary care level simply don't have time to do that. And at the end, I will just show you how it looks, that form. My colleagues from surrounding countries, some of them will understand. And this is this form, which we should fulfill. And that's it. That will be all. Thank you very much for your attention.